So here we are in the middle of this. Do you think it's helpful when we're already hearing a lot of Americans say they're not going to get the vaccine, and it's hard to get, herd immunity is going to be hard to come by. So it's important that as many probably get a real vaccine as possible. Do you think it's helpful when Bill Gates questions the FDA's motives and competency in okaying this, in approving this vaccine? Is that okay?
Look, this entire crisis has been plagued by statements that I think are imprecise. And I think people who are in public health positions, people who are in political leadership positions, I think need to be very careful how they communicate about these things because they're very complex and they can't be summed up, frankly, in a soundbite. And so when you put out a soundbite that could potentially erode confidence, it does erode confidence. To your point, we're going to need people to have confidence in the process and confidence in the integrity of the process. I think there's better ways to air those concerns in a more constructive fashion than the way that some of these criticisms are getting picked up across the political spectrum. So it concerns me. But look, to your original point, there have been some missteps by agencies and by political officials, right. And I think that then breeds further confusion.
Well,
Andrew.
Dr. Gottlieb, to that point, Politico over the weekend headline, Trump officials interfered with CDC reports on COVID-19. The politically appointed HHS spokesperson and his team demanded and received the right to review CDC's scientific reports to health professionals. What does that do to the credibility of these organizations?
It erodes them. That's wholly inappropriate, frankly unnecessary. Those MMWR reports were held in very high regard, and people didn't get to weigh in on those. They were treated as a sort of independent scientific process. There were MMWR reports that related to FDA issues when I was at the FDA, and I would see those reports as they were going out. They were carefully guarded in the same way that FDA carefully guards its review decisions and its regulatory prerogatives. So those should not be interfered with. And when you see things like that happening, that's the kind of stuff that erodes confidence. And it's frankly absurd to let that happen, to let these things happen on the margins that aren't important. And what you end up doing is eroding confidence for the really important things like a vaccine approval decision, because sometimes people can't distinguish where the government is and isn't going to be interfering because they're not there. They don't know. Now, I believe that the vaccine review process is going to be insulated from politics. But, how do people trust that when they see the things like what you're saying?
Why are you so confident that the vaccine process for emergency use authorization will be different and walled off from the treatments that we've seen given emergency use authorization, which then later on were found to not have the efficacy that was originally thought? I mean, you have President Trump basically saying to ABC recently 3 to 4 weeks to a vaccine, and when pressed and said, Dr. Fauci says it's going to be more like the end of the year, President Trump said, well, many disagree, but many agree, such as Scott Atlas, the neuroradiologist who he confers with. And I don't mean to knock neuroradiologists out there. I don't want them to come after us. But, you have the chief of infectious diseases of the entire land saying the end of the year. And the president is still saying 3 or 4 weeks, deferring to the judgment of a neuroradiologist who he's very close with. How can you be confident that this process won't be politicized and that frontline workers, who among them will be doctors, will actually say, you know what, we are still going to trust this process and we will, in fact, accept this vaccine and take it?
Well, look, because it's going to undergo multiple layers of independent review, and if it's interfered with, we're going to know it. And I don't think that the people who run this process and who are engaged in it at the FDA and the people who are external to the FDA are going to allow this to get interfered with it without letting all of us know it. I think you'll see resignations and you'll see something very public. I mean, I know the folks who are going to be engaged in this, and they have a lot of integrity and they jealously guard that process. So, anything can happen, but if something does happen here, you're going to know it. And if the process is preserved and they feel that they haven't been leaned on and they've had their ability to make independent decisions here and their prerogatives have been maintained, you're going to know that, too, because they're going to make that known. So, I'm pretty confident that we're going to have transparency into how this decision gets made. And I'm pretty confident that the mere fact of that transparency is going to discourage anyone from trying to lean in on this.